The recent outbreak of respiratory illness in China has raised concerns worldwide. However, it's crucial to rely on accurate information and avoid unnecessary panic. The virus in question is not entirely new or mysterious. It is the human metapneumovirus or HMPV, a common respiratory virus that has circulated globally for decades. HMPV is part of a family of viruses that cause respiratory illnesses, particularly during the winter and spring months. While it can affect people of all ages, young children, older adults, and individuals with weakened immune systems are more susceptible to severe complications. The recent surge in HMPV cases, primarily in northern China, serves as a reminder of the importance of public health preparedness. While HMPV is generally less severe than other respiratory viruses like COVID-19, it can still pose health risks, especially to vulnerable populations. Understanding the nature of HMPV, its symptoms, and modes of transmission is essential for individuals to take appropriate precautions and protect themselves and their communities. HMPV typically causes mild to moderate respiratory illness, and its symptoms often resemble those of the common cold or flu. The most common symptoms include cough, fever, runny nose, and nasal congestion. Some individuals may also experience shortness of breath, wheezing, and chest discomfort. In young children, HMPV can sometimes lead to bronchiolitis, an inflammation of the small airways in the lungs, or pneumonia. The incubation period for HMPV, or the time between exposure to the virus and the onset of symptoms, is typically 3 to 6 days. Most people recover from HMPV infection within 1 to 2 weeks with rest, fluids, and over-the-counter medications to relieve symptoms. However, it's essential to seek medical attention if symptoms worsen or if you experience difficulty breathing, persistent fever, or chest pain. Early diagnosis and supportive care can help prevent complications, especially in high-risk individuals. The recent outbreak of HMPV in China highlights the interconnected nature of global health. While the virus is not new, its resurgence in certain regions underscores the need for ongoing surveillance and international collaboration. Health officials in China have been monitoring the situation closely, tracking cases, and implementing measures to control the spread of the virus. The initial outbreak was detected in northern China, but cases have also been reported in other parts of the country, including Wuhan. The World Health Organization and other international health organizations are working closely with Chinese authorities to provide support and guidance. Countries around the world are also on alert, stepping up surveillance efforts and implementing health screenings at airports and other points of entry. The global response to the HMPV outbreak demonstrates the importance of preparedness and coordination in addressing infectious disease threats. By sharing information, resources, and expertise, the international community can work together to mitigate the impact of HMPV and other emerging health challenges. While the recent surge in HMPV cases may be concerning, it's important to remember that there are effective measures individuals can take to protect themselves and others from infection. HMPV spreads primarily through respiratory droplets released when an infected person coughs or sneezes. These droplets can infect others who are in close contact within about 6 feet, or by touching surfaces contaminated with the virus and then touching their mouth, nose, or eyes. One of the most effective ways to prevent the spread of HMPV is frequent hand washing with soap and water for at least 20 seconds, especially after coughing or sneezing, and before eating. If soap and water are not readily available, alcohol-based hand sanitizers containing at least 60% alcohol can be used as an alternative. Other preventive measures include covering your mouth and nose with a tissue or your elbow when you cough or sneeze, avoiding close contact with sick people, and cleaning and disinfecting frequently touched surfaces. In addition to these hygiene practices, staying home when you are sick can help prevent the spread of HMPV to others. Vaccination against influenza and pneumococcal disease can also provide some protection against secondary infections that can occur with HMPV.